It sounds extreme, but yes, it is possible to dislocate a rib from something as simple as sneezing. Now, it's rare, but a powerful sneeze creates a sudden, intense pressure in your chest and abdominal muscles. If you already have weak connective tissue, a prior injury, or a condition like osteoporosis, that pressure can actually shift a rib slightly out of place. It's more likely in people with hypermobility or certain musculoskeletal issues. While most people just feel sore ribs after sneezing hard, in rare cases, the joint between your rib and spine or sternum can misalign, causing sharp pain and even difficulty breathing. Follow for more surprising health facts. And if you're in pain or need a consultation, call 281-271-3888.